My article name is A Creative Reminisce Program for Older Adults with Severe Mental Disorders, and it's the result of a pilot evaluation. So, research shows that older adults with severe mental disorders experience major life dissatisfaction. So, this may be due to loss of a loved one, the chronic effects of aging, or towards the physical health problems. The pilot evaluation consisted of Search for Meaning of Life, which was a program to improve their life satisfaction. It consisted of reminiscing and creative aspects and storytelling. So the method was once 1 week before the program and once prior to the program, a week after, they interviewed the participants asking questions like, how do you feel about reminiscing? Do you have suggestions for future programs? How do you feel about the duration of the program and the amount of people in the program? The participants consisted of 36 people from 3 separate psychiatric hospitals. One of them was from a sheltered housing program. To keep track of the feasibility and acceptability, a log was kept containing observations and attendance. So subjects were eligible to participate if they were 55 years or older. Physicians judged if they were eligible to participate. On average, the age of the participants were 67 years old. 72% of them were female. So 2 participants were married, 44% of them were divorced, that's almost half, while over 30% were never married. That suggests that they may never have had kids, leaving 20% of the population widowed. So those are all risk factors for depression. Many of the participants had psychiatric disorders. 25% of them had mood disorders, 11% with amnesic disorders, and 6% had substance-related disorders, which may actually increase the effects of aging. 18 of the participants currently had clinical depressive symptoms. So that's 18 of the 36%, or 36 of the participants. So there was 12 sessions weekly. So they were 1.5 hours long each, and they consisted of 7 to 8 participants per session. The results were about 78% of the participants completed the course of the intervention. Only 1 session on average was missed of the 12 per participant, which is pretty good. 40% of the participants actually wished for a longer program. Half of the participants expressed that they felt better after the intervention. Over 2/3 of the group expressed positive feedback for reminiscing as an activity. A small amount of the group did not like the intervention. They didn't like to look back on their past. The program focuses on positive memories. The study suggests overall that reminiscing programs are acceptable and feasible by patients for mental illnesses. So some of the patients with psychiatric disorders actually experience significant increased depressive symptoms, which might be a result of the difficulty functioning in large groups. But a big portion of the group experienced more positive attitude towards aging after the program. So some limitations of the program or of the study might be that the group size. So it might be more valid if it was a larger sample group. Some research towards determining what might be contributing to the causation of the increased depression symptoms among that small portion of participants with the psychiatric disorders. So textbook relations. This article is relevant to the course and to the article and to the text due to the fact that the population is aging. This article suggests that it might be critical to decrease their depressive symptoms as the population is aging, so it might suggest that it's important for students who are studying in mental health to understand the upcoming high demand in this particular population. So it might be a good population to look into because it might be in high demand for work. So according to the textbook, people are more likely to develop mental disorders at times of increased vulnerability. So it's inevitable for older adults to experience extreme life changes as they increase with age because They might lose a spouse or a loss of a loved one. Moving into assisted living is a huge life change. There's increased emotional vulnerability and physical changes to the body due to these supports and to the coping abilities of these older adults. Older adults may experience major depressive disorder. It's nearly 4 times as common in younger adults as it is in older adults. So it's common for older adults to be experiencing chronic depression. So this suggests that depression might be decreased by reminisce programs. Also, since suicide is actually an increased risk in individuals with the variety of mental health problems in older adults, reminisce programs might increase their friends and their social connections, which might decrease the risk of suicide. This activity might help them adapt their environment better as they make more friends. Also, this is relevant to the practice of therapeutic recreation because in the field of TR, I can actually use programs like Searching for Meaning in Life as interventions with my clients because this article does show benefits to increase the meaning of life and life satisfaction through creative expression and reminiscing. It is beneficial to look back on the past and ideally look back at positive memories, which help people connect each other with by talking about what they've experienced in their past. So the findings help show creative expression and reminisce activities are beneficial in making people feel better. So as my job as a TR, I can help people better their quality of life and increase their life satisfaction.